Welcome back, Dr. Bell, Dr. Teresa, and Kat's with us again, our general manager. Today's topic, eyewear brands, and National Eye Exam Month is coming up. So we want to talk a little bit about why you should get an eye exam. Why don't we just start with that? Why? Let's all weigh in on why someone should get an eye exam annually in general.
Because society has gone from 58% visual to 78% visual, and there's some drawbacks in that, but the fact is it is 78% and only 22% audio and tactile. Now, what that means is that if you're going to keep up with society and the technological revolution that we are in the midst of, you're going to need your eyes more than ever, and you only get the one set. So taking care of them is even more important than taking care of if you were only allowed to have one car. You get it serviced regularly and take care of it. And this is the same principle, except you really do only get one set of eyes. So that's why it's important to do, and particularly as you get older, when your other senses start to decrease and the visual becomes even more important.
Well, I know, we've talked about this before, and that's the great thing I think about our practice is, if someone comes in and they say, hey, it's a little blurry, I can't see. Oftentimes I think everyone assumes, hey, it's the glasses, the prescription's changed. But if you don't do a complete comprehensive eye exam and look at everything, how would you know for sure? Certainly we're going to check that prescription, whether it's glasses or contacts, but we're also going to dilate patients. We're going to look in the eye. Maybe it's the blood sugar. Maybe this patient's diabetic. Maybe it's cataracts. Maybe they've got corneal edema. Maybe they've got macular edema. There's so many levels and parts of the eye that if you don't take them all into account and look at all of them, I don't know how you can accurately, monitor a patient, check a patient's health, and kind of look at the long-term ocular and eye-related issues. And that's something we've always done. And I like that about us is because, yes, we do the simple things, but we also do the tougher things. We have, OCTs, we have visual fields for all these conditions like diabetic retinopathy, glaucoma, hypertensive retinopathy, plaquenil, hydroxychloroquine. There's a lot of conditions out there, a lot of medications nowadays that we certainly want to monitor and make sure they don't lead to ocular toxicity or issues. And as a unit, we do those things.
Well, I think the term eye exam is bandied about much too loosely. So people that say they give eye exams, for instance, free eye exams, and then prices for glasses and other accoutrements are very inaccurate in their advertising because they're assuming you're getting the full eye exam.
Right.
And if you didn't have the equipment to do it, then by definition you wouldn't do it because you don't have it there.
Well, speaking of that, I had a patient that I saw Friday last week that, we're not going to mention any names, that went in and was a virtual eye exam and just didn't feel comfortable with it, didn't feel like they were getting the attention, weren't able to speak directly with the doctor in front of them and ask them questions of, hey, why is the left eye worse than the right eye with my son, things like that. So they came into us so we could address those things, talk about it, go into details, and talk directly about the issues.
Yep. Not everybody needs a Jiffy Lube. They need a transmission check, radiator check, engine check, and everything else.
Correct.
So I was going to, just to add on to that, one of the things when, I work a patient up in an eye exam, in a room before the doctor sees the patient, they always ask wow, you're asking a lot of questions. And I apologize. I'm so sorry, but this is part of our comprehensive eye exam. So a lot of patients don't realize, why do I need to know all this medical history? Why do you care? Why do you things? And, he talked a little bit about it. Medication side effects can affect your vision. So that's part of the reason why we want to know. We want to know if you're hypertensive, if you're diabetic, because what a lot of people forget is there's blood vessels behind your eyes. And when we say retinopathy, that means you've got bleeding in the back of your eyes. So I know we use the term retinopathy a lot, and so for, in layman's term, it pretty much means you're bleeding in the back of the eyes. So that's why we always ask if you're hypertensive or diabetic, just because we're checking the blood vessels behind your eyes a little more careful. We also want to know about if you have family history of glaucoma or macular degeneration and things like that, because those are genetic, that plays into genetics, is hereditary. Early detection is key, as we've all mentioned before. So, not only are the techs just checking the vision, they are getting a full comprehensive history, your health history, your medical history, your family history, and things like that. Because all those things, I feel, play a big part in how the doctor diagnoses you as far as your eye exam goes. So when I tell patients that eye exams take about 45 minutes to an hour, they're like, oh, it's not 45 minutes or an hour of me waiting. Not really. It's 45 minutes to an hour because we do such a thorough check. We take measurements. We have all the latest equipment for taking, measurements, like I said, pictures, scans and things like that to give you a full comprehensive eye exam. So it will take about 45 minutes to an hour because of all that.
I'm a big believer in the more information, the more scans, the more tests, the more you have, the better you can diagnose, treat, and assess a condition. So I would never discourage from doing more tests and figuring out what we need to kind of help this patient out.
So in this age of short attention spans and quick answers, people like, I have blurred vision, so it must be this.
Right.
It doesn't must be this. It could be 15 things. You don't know.
Right.
But you have to check all those little avenues out, even if a lot of times you don't get anything, but sometimes you will.
For sure.
And you only get the one set of eyes.
Yep, no doubt. And the other thing I get a little bit of pushback is medication. We always ask patients what medications you're on, and some patients have a long list of medications. But the reason we ask that is because if we have to prescribe, let's say for glaucoma, for instance, certain medications may interfere with other medications you're on. Do you have COPD? Do you have bronchitis? Do you have problems breathing? These are things we need to know before we prescribe a medication for you that systemically could have an issue with you. So those are another reasons we ask all those questions to kind of figure out at the end, before we assess your condition and figure out how to treat you, we want to know this and figure out, hey, maybe this medication is better for you and maybe this medication is better for that patient. So that helps steer us in that direction.
Again, it's almost so if somebody has a severe kidney disease or they're on dialysis and they have an infection and you have to what they call titrate, that is, adjust the level of that medication for that person's circulatory system so you don't further botch up the kidney and cause a toxicity that will put them in a deeper hole because of an eye infection.
And even nowadays, certain medications that since I graduated school and now we've all kind of learned, especially primary cares, as far as adjusting dosage of medication based on sex, based on weight. So we don't see as much ocular toxicity as we once did on some of these medications. So over the years, things have evolved, the information's gotten better, and we've learned how to better treat and better manage these patients.
But also there's new medications coming out.
For sure. Yep.
Well, part of getting a comprehensive eye exam is dilation. We get pushed back on dilation all the time.
That's the big one. Nobody
wants to be dilated. Just, we understand the side effects. It's going to make your vision blurry for the next, your up close vision blurry for the next couple hours. It makes your eyes sensitive to sunlight. But keep in mind, this is something that's done typically once a year. Takes an hour of your time. I feel like that hour of your time is super crucial. It's important for the doctors to even see the back of your eyes. So you want to talk a little bit more about how dilation works?
So there were days when hardly anybody got dilated, and the doctors do it differently also. But when a patient comes and see me, I'm warning you now, 98% get dilated. That number will either stay at that level or increase, because I don't miss things when I do that. And when I look a patient in the eye and say, listen, this system looks good to me, then I know for sure, as best I can, that system is in good shape.
Well, dilation in general, let's talk about, the pupil, back part of the eye is a certain, circle, but if we dilate and make that larger, certainly it's easier for us to see into the eye, especially the back of the eye, but also allows us a larger area to kind of see everything. And so that's key, because especially with patients with cataracts, if we can only see that portion of the lens versus seeing the whole lens, there's different cataracts that affect the lens differently. To be able to accurately assess that, we need to see the whole lens. And looking in the back of the eye, maybe this patient has a retinal hole. maybe they have lattice degeneration, maybe they have retinopathy, that's out in the periphery of the retina that you could not pick up or see unless you dilated that patient. So, dilation is key. We have a lot of photos, we have a lot of tests, a lot of scans, and all those things help us, but it still doesn't take the place of dilating the patient. In the state of Florida where we practice, that's included in an annual eye exam is dilating the patient. And certainly we prefer to do that because we've known and we've learned through the years it has helped us to pick up things that we may not have picked up if we didn't dilate the patient.
So if you were looking through a peephole for various reasons, which we won't go into, then if you looked through the small keyhole, you would get a view of what was going on in the next room. If you sought a hole that was 10 times larger than that, and let's say 4 inches in diameter, then you would see a much better view of what's going on in that other room. And your whole perspective changes on it. And that's happened to me a lot of times where I've looked in, I said, oh, this thing's good. And yet the patient gets dilated, and oh my, look at this. And I never would have seen it because I wasn't looking for it. Once you know what to look for, if the patient's hypertensive and you're looking at their blood vessels, you've already gotten a key to what the answer to the question is, so you know what to look for. But if they have a hidden condition that you didn't know to test for, that's a different bird. So you have to look around and hunt for that, not knowing that they may have it.
And as far as dilating, as far as the effects for the patient, if you're nearsighted, most often it really just makes your near blurry after the dilation. It doesn't really hurt your distance much. It'll make you light sensitive, but we'll get you some shades and when you leave to kind of help you if it's a sunny day. Now, if you're very farsighted, it does affect the distance a little bit, but still it predominantly affects the near. So, for those patients who are worried, maybe get somebody to drive you for that annual exam, come with someone. If you've had you dilated before in the past and it didn't bother you, it's probably not going to bother you this time. But certainly we want to dilate you and we want to look in the back of the eyes and check everything out.
And if you come in and you say, I'm not going to do this today, certainly most of our doctors will see you on another day at another time and not charge you a second visit. Just have it be part of the first so that we can dilate you at that time when it's more convenient for you.
In clinic, we run into that a lot. You made your appointment in the middle of a work day and you're like, I gotta go back to work. I can't get dilated today. And we will be more than happy to schedule you to come back, get dilated, let the doctor see the back of your eyes, put you in the slit lamp with all those magnifiers and bright lights, and let's take a look in the back of the eyes, because the 10 years that I've been with you guys, it's just like so many times we've had patients that are like, they were diabetic, they have high blood pressure, they've had a stroke, they've had all kinds of things that we were able to diagnose in office, but we wouldn't have been able to had we not dilated and looked in the back of the eyes. So I feel like, it's super important to get your eyes dilated for that reason, and you definitely will not get that out of a online eye exam for sure.
Yeah, the last thing I would say is a lot of patients say, well, hey, everything's good. I'm not having any problems. I don't need to be dilated. But, a lot of things, especially glaucoma we've talked about in the past, you don't even know you have glaucoma until late stage. So a lot of these things we pick up in the eyes, you wouldn't know. You wouldn't have complaints. You wouldn't say, hey, this is bothering me. My eye's hurting. So, sometimes, people with a stroke, you can feel it and you have signs leading up to that. With the eyes, a lot of these conditions you will not be able to know until it gets mid to late stage, and we don't want you to ever get to that point.
Yeah, you can't assume that just because you don't have a symptom that you're in good shape. That just means you don't have a symptom, but you could be in deep water and not know it, as Troy's saying.
Well, let's switch over. We're going to talk about eyewear brands. You want to take it, or what do we think? Yeah,
go ahead. We'll talk a little bit about eyewear brands. So we have 5 locations in the Panhandle, and we carry a wide variety of brands, glasses, sunglasses, and things like that. But I also want to let people know, we have package deals of frame and lenses starting at $89, and that's very competitive with online retailers. But however, our list of brands that we carry is going to be on our website. You're going to go to www.teresaoptical.com. You're going to click on the location, and you can go list all the brands. I will showcase, Palafox office is our largest optical. So it has all the high-end brands. So anybody that likes luxury, premium, definitely I would take a gander, take a look. I mean, any high-end type brand that's out there, we probably have the frame line there. I did bring a couple samples to just kind of show you guys today. One of the brands that we are showcasing is going to be Bahio sunglasses. And so Bahio sunglasses are made by the creators of Costa Del Mar. Living in Florida Panhandle, Costa has kind of overtook our market essentially in this area. But the owners have branched off, or the creators have branched off, and they started their own line. So the cool thing about Bahio is that they have 2 price points, which makes it easy. You don't have to guess. Their first price point is $209. So $209 is going to be your polarized with anti-glare, but in polycarbonate lens material. Their other price point is going to be $259, and that's going to be their glass. So a lot of our patients that are used to Costa Del Mar, they like the glass lens. These are just as comparable. These are just as good, and at the $259 price point. The next thing I wanted to show you is Ray-Ban Meta. So Ray-Ban Meta are your smart glasses. So we all know about smart watches. Now they've come out with smart glasses. So they come in sunglasses or in clear. They are built in with a 12 megapixel camera in there. You can record your calls. You can send text messages. Just like anything that you can with your smartwatch, you can do it with these glasses. What's super popular with our patients in this area is we get a lot of doctors, physicians that get these glasses. We get plumbers that get these glasses because, a plumber, for example, their hands are tied up in tools and pipes and things like that. So a lot of our plumbers like using these glasses because they can then say, they can answer text messages, they can record something, they can schedule something, they can, things like that. Like they need a part or something, so they can actually just tap the side and it will record what part are they looking at. So that way later on they can be like, oh, I need this part for this job. A lot of our physicians in the area like to use these smart glasses because then a lot of doctors, they don't scribe their chart when they're in the room with the patient. They're spending the time talking to patients. So a lot of times they like to use the smart glasses to record their exam and things like that. So that way they can go ahead and scribe the chart, transcribe the chart in later. I'm a little curious though. I'm not sure how they do in poker rooms yet in the casinos. So, but other than that, yeah, so these are the latest technology. These are Bahio and Ray-Ban Meta are at our downtown Palafox location.
Well,
Yep.
I would say this, and I get this quite a bit. We currently have 5 locations. You can get, and we're all on the same chart,
System.
same EMR chart. So a lot of times I'll see the patient. Maybe you and I are seeing the patient at one office, but they may say, "Hey, I need safety glasses," or "Hey, I'm looking for these specific Ray-Ban sunglasses," and we'll go downtown to Palafox or elsewhere to purchase. So you can have your eye exam at one location, and you can certainly take that prescription, or we can, it's on your record electronically. We can pull it up at the other office. So we're all interconnected, so I don't want a patient to ever feel, or they may say, "Hey, I was seeing you at Palafox or here forever, and I've moved over here, and I want to transfer over here to this location because it's more convenient." So we're all on the same system, and we try to make that as easy a transition as we can.
The 5 offices have 5 different groups of frames that are selected for that area demographically by the companies that we deal with. So we take their recommendations. And so Milton's frames, for instance, for males age 35 and above is very different from Foley's. And so when you go there, some types may appeal to you more than others, and if you don't want to put yourself in that slot, then visit all 5 locations and knock yourself out, okay?
I would say ask. If you're at a location and there's a specific frame that you're looking for, ask the optician and say, "Hey, do you guys carry this frame? Does one of the other offices carry that frame?" Sometimes patients don't realize that when we make an order, they say, "I like this frame, but maybe it's too small, or maybe it's not in the color that I want." and we can, oftentimes order that frame in a different color or
In a
larger
different
size.
color, yeah.
So always ask and say, hey, this is the one I'm interested in, but this one doesn't quite fit me, or maybe the temples aren't long enough. So always ask. But thanks again. Time goes too quick. We appreciate you guys joining the podcast. Again, I thank you, Kat, for joining in. Good information on all the frames and going through that with us. We appreciate y'all listening.
Thank you.
And liking and commenting. Stay tuned for future episodes. Thank you.
Stay well.